Hello, and welcome to the Pet Healer Podcast. This is your host, Dr. Mitzi Vargas, and this is our last one of the year, my friends. So we are going to end up this season with understanding canine influenza. We are doing this because this is the conclusion of our series on upper respiratory infections, and the reason is, of course, we saw that mysterious since October of this year. More states like Colorado and the Midwest and Georgia having a lot of cases with an uptick on upper respiratory diseases, and some of them were coughs that lasted over 8 weeks. We in this series we started with the herbs that are great for antivirals, then we continue with herbs that are expectorant, and we finished last talk with the herbs that are great for immune stimulant. And so now we're just going to talk about the pink elephant in the room, which is influenza. I think that is going to be proven. I don't know, time will tell, that some of these uptick was maybe a new variant of influenza, canine influenza. But what do we know about influenza right now? Well, we know that in humans there's 4 types of influenza, but for dogs there's 2, H3N8 and H3N2. And the H3N2 caused a lot of headaches when it came out, and it looked exactly the same, this mysterious thing that it didn't seem to get better, and then voila, they discovered it was a new strains of influenza. And so just in case, we have seen in the PCRs that we have sent on our patients that have been coughing, a lot of them have come negative for everything. And we do test for influenza, parainfluenza, and the H3N8 strain, and other the usual suspects, mycoplasma and kennel cough. And so we've received back 2 positive for mycoplasma, which is a common bacteria that we see an uptick on this time, the winter time. So just like in humans, there's a seasonal uptick on influenza cases in the winter. Dogs and cats seem to have an uptick of kennel cough and mycoplasma in the winter. But what we've seen is that the flu is worse in the summer, at least in Florida, with the wetness and there's more opportunity for the flu to stay alive in the warm and humid areas. So H3N8 was the first strain that was discovered in 2004. And I have been a veterinarian for 30 years too. It's funny, look back in 2004. Well, I remember when this thing came out. And it was an equine influenza virus. It just transferred. Influenza is very adaptable to cross species, and just like avian influenza, swine influenza outbreaks, all of those have transmitted to other animals. And it's always the scared, will this be a new pathogen in this species? So in 2004, it was proven that this strain, H3N8, has an affinity for dogs and can cause a severe persistent cough that could last from 2 to 6 weeks, 8 weeks. And the cough is usually non-productive, but it's a honking sound, which makes it very similar to kennel cough. The weird thing is that it also has sneezing. And the sneezing is how they transmit it, because they can really spread the virus through the sneezing and the nasal discharge. And the H3N8 used to have a clear, could be thick but clear mucus discharge. So these dogs also look like distemper, because distemper has this eye goobers and nasal discharge and fever. Most dogs don't develop a fever, or they might develop an initial fever and then they won't show any more fever. But they all seem to be tired. They sleep a lot more. So the treatment for H3N8 has to do a lot with support, with rest. These dogs need to be resting. They don't need to go to daycare or do run 5 miles. They need to decrease exercise, just calm down, make sure they hydrated. Sometimes you have to take them to the veterinarian to be hydrated, and sometimes you just have to just make sure you could use Pedialyte, the non-flavor one, and make sure that you offer it to them. The veterinarians we were prescribing back in 2004, just trying to cough suppressants, and antibiotics. That's the usual doxycycline. Still a good old doxycycline. It's an all antibiotics that has immune stimulant properties, and it really works for even though it's a virus, and doxycycline is an antibiotics, and most antibiotics do not work with virus. Doxycycline kills mycoplasma and kennel cough, so it seems to be the first round of the first line of defense for veterinarians to send doxycycline. And but the virus goes in there like a rock star and wrecks the room. And then the secondary issues are the bacterial infections. So it's great to use doxycycline anyway. Isolation is the main thing. If your dog feels bad, just don't take them with the neighbors. Don't continue to spread the virus. The H3N2 strain, that one was discovered in 2007. And believe me, it's probably the same H3N8 that mutated. And this one, so the other one was from equine influenza, and H3N2, there's suspected that come from avian influenza. It is highly contagious. This one was way more contagious than H3N8. The symptoms are the similar that we discussed: the sneezing, the nasal discharge, coughing. Some dogs had fevers that progressed to pneumonia. So the big outbreak of 2018 here in Florida, with the flu, it was H3N2. We saw, oh Lord, it was so infectious, and we saw a lot of the dogs, about 20% of all the dogs developed pneumonia. They were the elderly, they were the ones that were unvaccinated, and some of them got better, but it took a long time to get better. 10 days of hospitalization, and they would get better. But then the hospital became the incubator for the disease. And that's why one of the things that we did after 2018 and COVID is we added the extra ways of keeping the pathogens at bay, using our air conditioned system, using UV light that kills as the air goes in. So there's a new add-on to the air system, so that we can kill those viruses. And the other thing is using hydrogen peroxide. So we noticed that the hydrogen peroxide cleaners are much better at taking these influenza viruses. So if you are thinking, how come I get infected, or if I have a hospital or grooming salon or something like that, use the cleaners, change your cleaners. Some of them will work, and Clorox has a hydrogen peroxide cleaner that you can use. Is not Clorox itself, it's just a brand, but hydrogen peroxide cleaner that works very well with influenza strains. The treatment is always going to be management of the symptoms. It really is, and support, rest, fluid therapy, isolation, medications. I definitely discuss many of the herbs that we can use for these pets. Once they have pneumonia, then definitely is a more aggressive practice, is definitely trying to keep the IV fluids, IV antibiotics, nutrition, just trying to keep them up. So once you got a pneumonia, it's a little bit harder, but before it gets to pneumonia, they're coughing and they're moving around, and the more they rest, the better they do. And the more you add some of the herbs that we discussed in the previous 3 segments, the better results, the shorter the duration that these pets will have. And some herbs, if it's too hard to get the herbs by themselves, you can actually try some preparations like Jing Chao, which is in humans and it can be used in dogs, and Jade's grenade, which is another Chinese medicine formula that is used widely in China for the prevention of influenza season and upper respiratories. Please speak to your veterinarian and tell them about these herbs that you've been learning and how you can use them and if they interact with anything that your pet is taking. But then always remember that influenza continues to mutate, that maybe by the time this airs out, they will have discovered what caused the mysterious illness. But that next year is another season, and of course there's a chance that there's a new mutation, new strain of influenza. So I hope you learned something, and if you did, great, share it with your friend, hit the notification button so you don't miss the next episode, and until then, stay well.